Hello, dear patients and colleagues. Today I would like to explain what is the correlation between acid reflux and obstructive sleep apnea. It's because that question appears often and I just explain it repeatedly, and I decided I'll just record it and guide anyone who wants to understand it to this little video. There is still a dispute what comes first. Is it the reflux or closure of the airway? I am quite confident it is actually the closure of the airway creates the negative pressure that pulls the content out of the stomach. And I would like to just explain it to you now with nice images. So here's an excellent overview image showing where is our stomach, yes, and the esophagus traveling to the area of the mouth, and just in front of it we have larynx and trachea going to the lungs. Now there is also another lovely image. There we go, a little cross section here, so you can see this is basically our tongue, yeah, in a cross section. Here we have entry to the lungs, this is the larynx, and here is entry to the esophagus all the way down to the stomach, just here. So if you can imagine, when patients are lay horizontally, when they are sleeping and they're approaching the very deep sleep with a very deep relaxation, the tongue, especially when the whole jaw is a little bit protruded, when you have patients with jaw positions in the back where it couldn't really come forward, and there are reasons for that as well, or when patients lose their teeth and the space for the tongue becomes reduced, and the only place it can really travel to is to the back. So what can happen when the tongue collapses on the pharynx here? It basically doesn't allow the air, you see this is nose chamber, come into the lungs. Yes, so you can just imagine that this tongue closes completely, yes, that section. So the lungs, they are pulling the air down. This is the negative pressure. They want to suck in the air. Now, because the roof here is closed, what happens, it pulls out the content from the stomach. So the content of the stomach travels all the way up and suddenly it appears in the mouth. And patients develop multiple erosions in the mouth, and I would like to show you our representation of that. So these are teeth erosions. This is what we see in patients who do have acid reflux, and because patients who struggle to breathe at night, they can develop range of symptoms, and one of them is content of the stomach appearing in the mouth, and this is the representation you will see in the patients. So I hope that was helpful, and I think I'll be just recording a few more just to put it all in one place and just let you gradually educate yourself on quite a lot of symptoms that obstructive sleep apnea can develop over the years, and obviously it's better to stop it early. Take care.